Welcome back to the deep dive. Today, we're tackling something quite common, that nagging pain on the outside of the hip. Ever felt it?
Oh yeah, it's a frequent flyer in clinics.
We're talking about Greater Trochanteric Pain Syndrome, sometimes called trochanteric bursitis. We've got our revision notes here, and the mission is simple. Unpack this for clear understanding.
Let's do it.
Okay, so let's start right at the beginning. What exactly is the Greater Trochanter and this bursitis thing?
Right, so imagine your thigh bone, the femur. On the upper outer part, there's a bony lump that's the greater trochanter.
Gotcha.
And near it, you have these little sacs called bursae. They're like tiny cushions filled with fluid.
Cushions for what?
Basically to reduce friction. They sit between the bone and muscles or tendons that move over it, like the big iliotibial band running down your leg.
Ah, okay. So bursitis is when that cushion gets angry.
Exactly. Inflammation of that bursa near the greater trochanter. And the main thing you feel is pain right on the outside of the hip. It's particularly common in women, often between 50 and 70.
Interesting. So what makes it flare up? What are the sort of triggers or causes?
Well, it's often down to repetitive stress. Think running, cycling, even walking patterns over time.
Overuse?
Yeah, overuse is a big one.
Yeah.
Or sometimes a direct blow, like a fall onto the hip trauma. Muscle imbalances around the hip can contribute too, pulling things unevenly.
And it can be linked to other hip issues, right?
Definitely. Sometimes it crops up alongside things like hip osteoarthritis or tendonitis in the nearby muscles.
Okay. Are there specific risk factors, things that make someone more prone to getting it?
Yes, absolutely. Things like poor biomechanics, the way you walk or run. Being overweight adds extra stress.
Makes sense.
Previous hip surgery can sometimes lead to it. And certain medical conditions, like rheumatoid arthritis or even gout, can play a role.
Is there an easy way to remember those?
Someone came up with a mnemonic ROT-MOP. It's a bit silly, but it works. Repetitive stress, overuse, trauma, medical conditions, obesity, and poor biomechanics.
ROT-MOP. Okay, I'll try to remember that. So pathologically speaking, what's the process inside?
So the thinking is that this repeated rubbing, this microtrauma, kicks off an inflammatory response in the bursa.
Right.
The bursa swells up, produces more fluid, gets thicker, and that increased pressure and inflammation causes the pain you feel on the outside of the hip.
Now, hip pain can come from lots of places. How do you differentiate this from other things?
That's crucial. You need to rule out other potential culprits. Things like actual arthritis in the hip joint, tendinitis of the gluteal muscles.
Like the gluteus medius.
Exactly.
Yep.
Or maybe a muscle strain or even a tear in the hip labrum, which is the cartilage rim of the socket.
So a thorough evaluation is key.
Absolutely. Taking a good history, doing a proper physical exam. Sometimes imaging helps rule things out, but often it's a clinical diagnosis.
How common is this? Do we have numbers?
Specific UK data is a bit hard to pin down, but clinical experience tells us it's, well, very common, a frequent cause of lateral hip pain presenting to GPs and physios. And it affects all sorts, not just athletes.
What are the classic signs someone might describe? What are the clinical features?
The absolute hallmark is pain and tenderness right over that bony bit, the greater trochanter.
Okay.
Sometimes the pain can radiate, sort of travel down the outside of the thigh, maybe towards the knee, but usually not past it.
And what makes it worse?
Classic things are walking, climbing stairs, getting up from a chair after sitting a while, and a really key one is lying on the affected side at night. That direct pressure can be really uncomfortable.
Yeah, that sounds disruptive. Any visible signs?
Sometimes you might notice a bit of swelling or feel some warmth over the area, but not always. The tenderness to touch is more consistent.
So investigations you mentioned, it's often clinical.
Primarily, yes. The history and the physical exam pointing to tenderness over the trochanter, maybe pain with certain movements. Imaging like X-rays or MRI isn't usually needed for diagnosis itself.
But more to rule out other things.
Exactly, to check for arthritis, fractures, tendon tears, that sort of thing, especially if the picture isn't clear or it's not responding to initial treatment.
Okay, so let's talk treatment. What's the management plan look like?
The main goals are pretty straightforward. Relieve the pain, calm down the inflammation, and improve function. Address why it happened.
About first steps.
Usually conservative. That means rest from aggravating activities, modifying how you do things. Ice or heat can sometimes help with symptoms.
Painkillers?
Yeah, over-the-counter anti-inflammatories, NSAIDs, can be useful initially, but a really key part is physical therapy.
What does that involve?
Working on strengthening the hip muscles, particularly the abductors like gluteus medius, stretching tight structures like the IT band, and correcting any biomechanical issues.
And if that's not enough?
For more persistent pain, corticosteroid injections into the bursa can be very effective for settling the inflammation. Sometimes they mix it with local anesthetic for immediate relief too.
Injections, okay. What about surgery?
Surgery is really reserved for pretty rare, severe cases that haven't responded to anything else. Maybe removing the inflamed bursa? Ultrasound-guided injections are often tried before considering surgery, though.
What's the usual outcome? What's the prognosis?
Generally, it's good. Most people get significant relief with conservative management, especially physio, and maybe an injection if needed.
Yeah, it's good to hear.
But, symptom duration can vary. Some people might have it linger for a while, and it can sometimes recur, especially if the underlying factors like muscle weakness or biomechanics aren't fully addressed. Compliance with physio is important.
Are there any serious complications to worry about?
Thankfully, major complications are pretty rare with GTPS itself. The main risk is it becoming chronic pain, which can limit activity and impact quality of life.
Right.
Sometimes complications might relate more to the underlying cause if it's linked to something else like significant arthritis.
Okay, before we wrap up, any quick memory aids or like an MSRA-style question example?
For a memory tip, just visualize that greater bony bit on the side of your hip getting irritated, and the bursa is the cushion trying to help but getting inflamed.
Makes sense. And a question.
Okay, try this. A 62-year-old female presents with lateral hip pain, worse when lying on that side. Examination reveals marked tenderness over the greater trochanter. What's the most likely diagnosis?
Based on everything we've said, that sounds like Greater Trochanteric Pain Syndrome.
Exactly. Spot on.
Great. So a quick summary. We've defined GTPS, looked at the causes like overuse and biomechanics, how it presents, how it's diagnosed mainly clinically, and managed primarily conservatively with physio and sometimes injections.
And it really makes you pause and think, doesn't it?
Yeah.
Given how much repetitive movement is just part of modern life, walking, sitting, exercising, what simple, proactive things could people maybe do to minimize their risk?
That's a really good question for everyone to ponder. Definitely food for thought. And for those revising for their exams, if you need more high-yield resources like this for the MSRA, do check out passthumbsandSRA.com.
And don't forget, you can also grab free MSRA practice questions and other study aids over at freemsra.com. Definitely worth a look.